What to expect from a normal foot X-ray? Normal foot X-ray. If you have a pain-free foot and ankle, you've probably had a normal foot X-ray. This is great news, but it can also leave you confused. A radiologist may say there's no sign of a fracture, dislocation, or subluxation, but the treating physician may not be aware of the true reason for your discomfort. It's possible that you have an early-phase stress fracture, soft tissue tumor, nerve issue, or inflammatory condition. A normal foot X-ray is a clear picture of your feet. It shows all 26 bones, including 2 sesamoid bones. The toes, whose names include phalanges, are made up of 2 phalanges and 3 phalanges. The 5 tarsal bones, also known as metatarsals, are found in the midfoot. The calcaneus, which forms the heel, articulates with the talus and tibia, the pivot of the ankle. Unlike other types of X-rays, a normal foot X-ray may not show everything that is present in the foot. A repeat X-ray may have slightly different images depending on the equipment used at the medical center, but a high-quality image will still contain all of the information the doctor needs to diagnose your condition. Besides the bone structure, a normal foot X-ray is not good at imaging soft tissues, such as ligaments, tendons, and cartilage, which are important for joint stability. Fortunately, there are better methods for this. X-rays of the feet are a vital diagnostic tool. These images allow your doctor to pinpoint problems before surgery or other procedures. However, they can also highlight problems that you may be unaware of. A normal foot X-ray is a good way to get a better picture of your feet. By understanding how your feet work, you can make informed decisions about your health. It is essential to be as educated as possible and know what to expect during your foot X-ray. A normal foot X-ray should reveal a number of bones in the foot. The talus and sesamoid bones are visible and can be seen. In addition, the toes are made up of phalanx bones, big toe, 2 phalanges, and the other 3 phalanges. The midfoot has 5 tarsal bones that articulate with the metatarsal bones. The calcaneus and talus are the 2 pivotal parts of the ankle. A normal foot X-ray includes several views. The anteroposterior view is the most common. It is a good way to see the medial elements of the foot, including the cuneiforms. The talus is also a pivot for the ankle. The lateral view allows you to see the joints of the foot. You can also visualize the metatarsal bones. They are best viewed with an anteroposterior X-ray. X-rays of the foot are not harmful and are safe for most people. There is a slight risk of radiation exposure, but the radiologist will use as little radiation as is needed to achieve the best possible results. It is important to let the X-ray technician know if you are pregnant, as you will be more likely to be exposed to radiation if you are pregnant. The procedure can take up to 15 minutes, but the exposure time is usually less than a second. An X-ray of the foot can be helpful in diagnosing a foot injury. The lateral view is ideal for identifying a traumatic injury, while the anteroposterior view is useful to see the medial elements. Seeing the medial articulation of the Lisfranc joint is an important part of the normal foot X-ray. A lateral view is also useful to determine the extent of pain. A normal foot X-ray includes 26 bones. The big toe has 2 phalanges, while the other toes have 3. There are 5 tarsal bones in the midfoot, which articulate with the tibia. The calcaneus forms the heel. The talus is the pivot of the ankle. An X-ray of the foot can be helpful in diagnosing an injury. A foot X-ray can help diagnose common symptoms in the foot. It can detect fractured or dislocated joints, and helps a doctor assess the proper alignment of the bones. X-rays can also be helpful in planning and assessing surgical procedures. An MRI can show bone cancer, but it is very rare in children. It can be used to monitor the healing process of an ankle or other bone. Normal foot X-ray, normal foot X-ray, normal foot X-ray.